Hello and welcome to Healthy India. I'm your host Lottie Yalaric. Well folks, today we will be talking about something very significant that assures that each child grows up into a healthy citizen. Today we will be talking about the importance of immunization. Well folks, today I need to tell you that on March 23rd, the Health Ministry launched a nationwide immunization drive called as the Mission Indradhanush. Now what is this Mission Indradhanush all about? Are there any new additions to the injections that are given to the children or the vaccinations that are given to the children? And what is the outcome going to be? And there is a very definitive plan regarding this, and the government thinks that by 2020, 90% of India's infants are going to be immunized. Now how is this program going to take off actually is what we are going to talk about today. So to tell us more on the issue, I have in the studio three eminent doctors. I'm very happy to welcome Dr. Vinod Paul, who's the head of the Department of Pediatrics at the AIIMS Institute, Delhi. So thank you for joining us. We're also joined by Dr. Rakesh Kumar, Joint Secretary from the Ministry of Health and Family Welfare. Thanks for being here, and I'm sure you are the one who's going to tell us a lot about this program today. And we also have with us Dr. Dheeraj Bahel, Department of Pediatrics from the RML Hospital. I welcome you too, sir. So, well, folks, whenever a new scheme is launched, whenever a new program is launched, it is launched basically through the media. So the ministry has done a fantastic job of having a little capsule through which you and I and the other people in the country would be able to know what is this program, that is the Indradhanush program, all about. So let's take a look at this media capsule.
एक कदम हम चलें, एक कदम तुम बढ़ाओ, बच्चों को स्वस्थ, देश को खुशहाल बनाओ।
ये टीकाकरण चक्र है जो समय के साथ घूमता है। अगर इस टीकाकरण कार्ड के अनुसार तुम बच्चों को सारे समय पर टीके लगवाती रहोगी तो बच्चों को कई जानलेवा बीमारियों से बचा सकते हैं। ये चक्र टूटना नहीं चाहिए।
हजारों लोग हर बच्चे तक टीके पहुंचाने के लिए कई कठिनाइयों का सामना करते हैं। बच्चों का स्वास्थ्य हम सब की जिम्मेदारी है। समझदारी दिखाएं, अपने बच्चे का संपूर्ण टीकाकरण करवाएं।
Well, folks, the Government of India launched its universal immunization program in the year 1985. And as we all know that WHO declared India officially polio-free in March 2014. So that could only be done because of the sincere efforts of the government that have been through all these years. And we understand that the program will be beneficial and will be a success in the years to come too. But my first question to you, Dr. Vinod Paul, that this program that has been gone on for pretty long now, and of course it needs to go on further. What is an overview that you have of this program?
You know, in India, the immunization program has deep roots from the 70s, and then you said from mid-80s, we have universal immunization program.
Right.
It's a very well-entrenched program, and we're very proud that the vaccines that are being given to our children are our own, made in India. This program requires that every child, and each year India has 2.6 crore babies are being born. So each one of these babies has to receive the required number and the required doses of vaccines. So that is our challenge. At the end of the day, even with the acceleration that took place as a part of the National Rural Health Mission, a lot of augmentation, a lot of acceleration, still we find very sadly that 1 out of 3 children does not get the full quota of vaccines. What they should get, the whole complement of vaccines, let's say these 7 vaccines which are part of the Indradhanush program, 1 out of 3 misses something out there. And this is the purpose. And this is the motivation behind this current program. That time has come that every child should get every vaccine that he or she deserves. And I compliment the Government of India for making it into a mission so that this unfinished agenda for children, for the rights of children, is taken care of.
Right. Well, Dr. Rakesh, I'm sure you would have a lot to build upon as far as this program really goes. Mission Indradhanush. So first of all, I would want to know as to why was it named so?
Let me just take you to the background first. Our expanded immunization program is called EPI, which was launched way back in 1974. So this is as old as 41 years.
Right.
But initially it was limited to the urban areas. So meaning thereby, I think the rural areas and other parts of the country, they were really left out. Then, as you rightly said, Dr. Paul pointed out that 1985, our universal immunization program was started, so that the purpose was that we need to cover all the children, whether they're living in the remote areas or rural areas. So coverage was basically universal. We started then, we had our polio eradication program, which was started way back in December 1995. And now, as you rightly said, that for the last 4 years, we don't have even a single wild polio case, and that's why India, including the 10 more countries in the Zero region, they have been declared as polio-free. So I think we are proud of that.
Absolutely.
But at the same time, we find, Dr. Paul pointed out, that, one child out of 3, basically, is either left out or missed out. Our birth cohort is about 27 million, meaning thereby 9 million children are still left out or missed out. Or either they are partially immunized or they are, not at all immunized at all. Right. And if you look at the numbers, out of these 9 million, 7.2 million are partially immunized. And 1.7 million to 1.8 million is, they don't even receive a single antigen. So it's a cause of worry.
Absolutely.
If you look at the full immunization coverage, in 2009, I don't want to take you further back, but in 2009 it was 61%. In 2013 it increased to 65%, meaning thereby in 4 years our full immunization coverage has increased by 4 percentage points, meaning thereby just 1 percentage point per year. So if you just move with this sort of pace, further, it will take us another 25 years.
That's right.
To reach the 90% coverage. So then we thought that, we need to move into a mission mode. We need to do a sort of drive. And this mission, Indradhanush, why we, named it here, it's like, we have 7 vaccine preventable diseases. And there's 7 colors of rainbows.
Right.
So it was basically, it's very innovatively, I would say, and Christian to be as called as Mission Indradhanush. And fortunately, we are also starting our activities from 7th of April, the immunization activities. So another 7 added. And 7 April happens to be the World Health Day.
7 is a magical number.
Yeah, so 7 is a magical number. So the 7th April happens to be a very auspicious day when the World Health Organization was, it was constituted. So we are starting our activities, but Honorable Minister or the Health Ministry launched this program on 25th of December 2014. It is, and then, on 23rd of March, as you rightly said, we had launched this media activity, because media is a major component of this initiative.
Absolutely.
So this is how, the name was given. But media activities, again, I would like to highlight one thing about media activities. Why we are focusing more on media is because if you look at, we conducted a study, and we covered about more than 1 lakh families, and we found out that, why children or why parents are not really taking their children for immunization. And to our surprise, it's a very unhappy sort of note, In 32% of the cases, they did not know about the advantages of immunization. And in 30% of the cases, they only knew the side effects. Meaning thereby, in 62% of the cases, either they knew nothing about the vaccine or they knew only the side effects. So I think our main focus this time has been the kind of IC activities or awareness generation followed by these activities.
Right. Well, I think that's the perspective of this whole program, and I'm sure the public out there who's watching must have got a fair idea as to what is the significance of this program really going to be and why we need to be in a mission mode, as Dr. Rakesh said. So, well, folks, our lines are open right now, and you too can be a part of this forum. If you have any question, any clearance that you would want about this program, this is the time to pick up your phone and reach us at 1800115314 or 23035420. Now, Dr. Bahel, I would want you to focus a little bit on the fact that of course, we've been doing pretty well, but we need to do a lot more. Now, by 2020, to aim to immunize 90% of India's infants, now this is going to be very challenging. So what kind of an approach do you think is required for us to see the desired results?
Approach, basically, we should plan it. First is planning. If planning is very important, there is a common saying, if you don't plan, then you will literally fail. Failing to plan is planning to fail, basically. So planning stage is very important. We have to analyze our strengths and weakness. SWOT analysis of the situation has to be done. How many, by doing all the statistical analysis, the population, the number of children born, number of children vaccinated, how many of them are remain unimmunized or partly immunized, what are the areas where these 7 preventable diseases happen, or their outbreaks, or they are spread. You need to identify those areas, and then you take appropriate action by enforcing your man-machine material into these things. And of course, as Dr. Rakesh said, the communication aspect where we are lacking has to be reinforced. How it is reinforced? Just because by adopting both the traditional and the conventional and the modern methods. Modern means print and electronic media, which may not reach to the far end of the society.
True, true.
Majority and considerable number of these are illiterate, uneducated people. So the traditional methods like munadis and drums, this was pretty well carried out by the Pulse Polio campaign.
That's right.
So the Pulse Polio has given us a lot of inputs how to carry out this mission further. So that's
right. So Dr. Paul, as he mentioned, appropriate action plan. Now this is very easy to say, but it's a Herculean task to really achieve it. So in your understanding, what do you think that plan must really entail?
I think Dr. Rakesh Kumar has articulated the principles and the rationale behind it. We would check with him about how this program will be implemented at the program health department's level. But I would like to echo the fact that people's involvement is very important.
Is very necessary, right.
Professionals' involvement is very important.
Correct.
All the stakeholders have to join this battle. The government alone cannot ensure. And at this point in time, the children who are being left out are not the children of the rich people.
Absolutely.
These are the poor people, the migrant families, the children who are on the margins of a hutment or a village or a basti. These are children whose parents are working in brick kiln, bhatton pe jo kaam kar rahe hote hain. Us tarah ke bacche, the children who are traveling, children whose families are on the move. These are the children, and these are the poorest of the poor children. And I think the society has to embrace, just as we did, as Dr. Dheeraj very correctly said, in polio, it was a totally people's movement.
Absolutely.
Supply was ensured by the government and people rose to the occasion. So we have to ensure that people are involved. We must also ensure as doctors and professionals that the misgivings about the vaccines are taken care of. We should clarify it once and for all.
Absolutely.
Doctors also at times find one reason or the other to say, abhi nahi dena hai, abhi bimar hai, mamuli khansi. So we all have to join this battle and we all have a role. But I am really hoping that in order to reach that 90% benchmark that the government have set for all of us.
It may be difficult, but it's certainly not
involvement,
impossible.
Involvement of all stakeholders, the teachers, the district magistrate, the administration, and everybody, other than, of course, being led by the government.
The government, absolutely.
The departments.
Well, we have a viewer with us right now. This is Manoj Kumar from Haryana. So, Manoj, can you hear me, please?
Yes, ma'am, I can hear you loudly.
Welcome to the show, and what is it that you would like to share?
Thank you, ma'am. I would just like to thank the panel also. Madam, I just want to know, my son is 5.5 years old, and we left out MMR injection due to certain reason, madam. The reason was my elder brother's son, who is no more with us. He was given, he was an autistic child. And we were informed that it might be due to this injection that was given to him.
Okay.
So I left with this injection to my son that he might also may become autistic or something, ma'am.
Okay.
And he has not been given this injection. So I just want to know whether we can give him an injection right now, or there any possibility of any disease on him right now.
Okay, Manoj, just stay online for a moment, and I'd request Dr. Paul to take this up quickly, please, in case if you want to ask him anything.
I think first thing that all of us should understand, each one of our citizens should understand that when the government states that a vaccine should be given to every child, all the 2.7 crore children being born every year. Everybody should get it.
So it should
Then
be like
be
the gospel
sure
truth.
that we have taken care of these concerns.
That's right.
These are the vaccines and the immunization that we are giving is safe. It's not associated with any negligible, adverse effects.
So if your child is autistic, he does not have to be deprived of that
He
injection.
should have received it. There is no contraindication. You look at the
Right.
government document, you look at professional documents, there is no reason. So that's the first part. I think
Right.
this is how we miss people. This is how we miss children, even of the good families.
So this is a classic example of
classic
that.
example of the misgivings. The second part is that at this age, he's already 5.5 years. So he doesn't have to give MMR anymore, but should get rubella vaccine.
Right.
Okay?
Right.
And measles, if he has not received in the past, then measles, particularly not received at 18 months, because measles is also shifting. So I think he should receive the vaccine. And if nothing else is available, take MMR, if the split vaccines are not available. So he can take vaccine. But I think the public should be reassured that once the government is certifying an immunization program, it is safe, it is in the interest of all of us.
Right. So, Dr. Rakesh, I'm sure you'll agree, and this is such a classic example of even educated people, that missing out on these vaccinations. So, this clearly means that the actual instructions or the knowledge about these vaccines is not reaching a large number of people out there. And that is why so many doubts in people's mind. And also the other thing is that they start taking decisions on their own. Now, this is something that has to be avoided at all costs.
Absolutely. I think you've got a point to make, and I can assure you one thing, that these vaccines are certainly, every child needs to receive all these vaccines. We are talking about 7 vaccine preventable diseases.
Right.
Where we are talking about BCG, BCG is basically for your tubercular meningitis, then polio, we all know about the polio,
Yes.
then DPT, this is diphtheria, pertussis, tetanus, then hepatitis B, and then measles. So these are 7 vaccines. But as I would like to take you again to the planning process, because I think everybody must be worried
Absolutely.
that how you are going to achieve this
Right,
target, and
right.
target is
Is
say that
huge.
to me, it is not even difficult, and I'll tell you why and how. See, currently what we are doing, that we are looking at the missed out and the left out children. The number, as I said, is about 9 million. Meaning thereby, we are not going to disturb our routine immunization schedule. So any A&M who is conducting the routine immunization, let us say on 2 days, Tuesday and Saturday, she is going to conduct that.
Continue doing
But for the
that.
remaining
Right.
days, she is going to cover all those areas and pockets, like there could be some hamlets, there could be some riverbed mining site, there could be some brick kiln, there could be some migratory population, there could be some nomads around, or all those kind of or the villages which have been totally left out, where there have been no A&M, let us say maybe for the last 3 months or 4 months or so. So what we have done, that we have included all these areas and pockets into the micro plan of an A&M. So currently, like in polio, what we did, that we included all such areas, and what polio has taught is basically that we need to improve upon our micro plans. So currently we have identified about 400,000 such high risk areas in the country because of polio. So what we have done, that we have included all these areas into the micro plan of A&M. So now this A&M, so it is a health system strengthening. So this micro plan now becomes permanent with an A&M, and for future reference, she is not going to leave these pockets. So this is the one thing. Secondly, on the IC activities, I said there's a massive IC.
Sir, can I come back to that, this
Okay.
part, because we have a viewer with us for quite some time. This is Hari Singh from Delhi. So, Hari Singh ji, welcome to the show. Hari Singh ji, are you there with me?
Yes, I'm with you.
Yes.
Madam, my name is Hari Singh. I am drug addiction counselor in Delhi.
Okay.
Okay. And from last 20 years, I'm working in the field of HIV/AIDS and working with...
Right. So, tell me, what is your question, please?
My question is, अभी भी जो गर्भवती महिलाएं हैं, जो
जी.
और HIV पॉजिटिव महिलाएं हैं, उनके जो बच्चे बॉर्न होते हैं, उनको सही से सही जांचें और सही जो न्यूट्रिशन और इंजेक्शन वगैरह देने चाहिए, वो प्रॉपर्ली नहीं मिल पाते। और दूसरा, मैं देख रहा हूँ जो डिसेबिलिटी है, मेंटल मानसिक विकलांगता जो है, उसके अंदर सही शारीरिक जांच की जो व्यवस्था है सरकारी हॉस्पिटल में, वो अच्छी नहीं है। क्योंकि सबसे पहले तो जांच है, उसके बाद हम इंजेक्शन या दवाइयाँ देंगे। तो अभी हमारा डायग्नोस्टिक सिस्टम बहुत खराब है मैडम, ये डिसेबिलिटी में, और जो HIV पॉजिटिव महिला के जो बच्चे न्यू बॉर्न बेबी हैं, तो इसके अंदर थोड़ा सा सरकार की तरफ से मैं चाहता हूँ जो कुछ अच्छा डायग्नोस्टिक अच्छा हो और
Correct.
पूरे इंजेक्शन लगे।
Absolutely. Mr. Hari Singh ji, मैं समझ गई हूँ आप जो कह रहे हैं. So, before we went into the break, we had a viewer with us, but before we try and answer his question, we have another viewer. This is Mukesh Kumar from Uttar Pradesh. So, Mukesh, I hope you're there with me, and what's your question?
यस मैम, गुड इवनिंग मैम।
Good evening to you.
मुझे सर से पूछना है कि 1 साल तक के बच्चों के लिए क्या क्या वैक्सीन इम्पोर्टेंट है, क्योंकि मार्केट में बहुत सारा वैक्सीन है कि टाइफाइड भी लगवा लो, चिकन पॉक्स भी है, और मेनिंगोकोकल वैक्सीन है, और हेपेटाइटिस ए के लिए भी है। तो मतलब इसमें खर्चा बहुत आता है, तो मतलब क्या क्या मैंडेटरी वैक्सीन है जो बच्चों को लगवानी चाहिए, ये पूछा
जी। Thank you so much, and I think that's a good question too. But before, let's take the answer of the first one. We had Hari Singh with us, and who said that HIV positive females. Now these are the females sometimes who may not get their children vaccinated, and also he had some problems with the diagnostic techniques or the way it's really going on in the country.
I think it's a very valid question, and certainly you know, meaning thereby, you know, what he's trying to say here is that people must understand is that before the child is born, the antenatal care is very, very important.
Right. Right.
And in that, you know, like government has provided all the facilities. You go to any district hospital or the PHC or the CHC or sub-center. So that the pregnant woman must conduct, you know, get at least, you know, 4 ANC checkups conducted, you know, during the whole pregnancy period. Then 2 injections of tetanus toxoid, they are also very important. So as soon as, you know, the pregnancy is detected, the first injection, and within 1 and 1.5 months, you know, gap, another TT injections to be given. Similarly, third important component is your IFS supplementation, because these mothers, often you'll find, you know, more than 56-57% of these pregnant women, they are found to be anemic. So IFS supplementers, those 100 tablets which she is supposed to take at least 1 tablet per day, is also very important. Then healthy diet, nutritious diet is also very, very important. You know, through this regular antenatal checkup, you know, we are able to find out those high-risk pregnancies. So any high-risk pregnancy, like, you know, out of 100 pregnancies, 90% you will find they are supposed to be normal. It's only what worries us is those 10-15% of high-risk pregnancies or complicated pregnancies, which would then require a referral to a higher center for the treatment. So similarly, any mother who is, you know, with HIV positive, certainly I think she requires a higher, you know, referral to a higher center and then treatment accordingly. But the vaccination has to be continued. There's no, you know, second thought about
that. All right.
About the second question, you know, which
yes,
from Mukesh, you know, I think all those, the government is focusing on these 7 vaccines. And what we are saying that within 1 year, these 7 vaccines are very important. For example, 0 dose of polio. As the child is born, so 0 dose of polio, hepatitis B and BCG. These are the 3 vaccines which are to be given, you know, as soon as the child is born. Second important comes, you know, your basically 6 weeks, 1.5 months. It is your polio and DPT. So, you know, 1 dose. Then after a gap of 1 month, again you have DPT and polio. Then again after the gap of 1 month, again DPT polio. So 1.5 months, 2.5 months and 3.5 months, these 3 doses of polio and DPT are to be given. Then at 9 months, basically again it becomes important, you know, for us to give measles. So by the child is, and then hepatitis B. Hepatitis B is also the similar, you know, so 3 injections with DPT1, DPT2 and DPT3. So these 7 vaccines, you know, 3 are in DPT, 1 polio and 1 hepatitis B and 1 measles and BCG. So put together is 7. So I think all these 7 vaccines are extremely important, you know, and they are very much part of our government program, which are being provided free of cost at all the government facilities.
Right. And Dr. Bahl, also I guess he may be wanting to know about certain other vaccines, you know, which sometimes if you're in the private sector, whether it is the HPV or maybe some other vaccine. So are these important, and at what age should they be given?
Ideally, every vaccine, every child should be immunized against all vaccine preventable diseases. But the big worry is the affordability. And with the 80% of the India's health sector being in the hands of, is being manned by the private sector, so they emphasize on this all vaccinations. These are right from rotavirus, you can say, exemplify I'm saying. Then we have H influenza B. Yes, of course, now government is also providing H influenza B vaccine in certain centers, certain states. Then we have pneumococcal vaccine. Again, given these 2 vaccines are given at say at 1.5 months, 2.5 months, 3.5 months. These are vaccines which are to be given up to 1 year. Then we have hepatitis A at the age of 1 year, and then chickenpox at 15 months. So and meningococcal vaccines after 2 years, and typhoid is provided by the government. So these are the 5 vaccines which are additionally available in our private sector setup. Government is not able to provide as of now. But lot of emphasis be done because prevention is always better than cure.
Absolutely.
So lot of deliberations are going on with the government and with the people who are planning commission, and with all these experts, the deliberations are on, and cost is a prohibitive factor. Yes.
So which means that the ones who can afford must go for those vaccines. Is that what you're saying?
Yes, yes. Even they have made a suggestion that you explain the vaccine, the type of vaccine to the patients. And if they can afford it,
then
they can go ahead.
All right, all right. Well, we have another viewer. This is Srinivas Kumar from Jharkhand. So, Mr. Kumar, welcome to the show.
Yes, madam. Thank you, madam.
Yes, please go ahead.
Hello, madam.
Please lower the volume of your TV set, Manojji.
Yes.
Sorry, Srinivas.
Yes, madam. Myself, Srinivas Kumar from Jamshedpur. Madam, hello.
You have not lowered the volume of your TV set. I'm afraid I will not be able to continue. All right. Now, this is just as a reminder for the viewers who are watching that when you call us, please keep your volume of your TV set to the bare minimum so that we can hear you through your phones and you are able to listen to the panelists and take advantage of this opportunity, because there are many people out there who would want answers to their questions. Now, Dr. Paul, there's an immunization card that is given to every child the moment a child is born, a baby is born in an institution. Now, what is the significance of this immunization card, and how long should this be kept with the child, with the parents, and how what are the benefits of keeping this with you?
Actually, this card is a mother-child card.
Right.
Because this card is given at all the government facilities where the mother registers herself for antenatal care.
Right.
So it begins there. And it has fantastic advice. Very clear advice is given in local language. Now, the baby part is a record of child's immunization, because people cannot remember exactly when a particular vaccine was given.
True.
You know, vaccines are being given in 6 weeks, 10 weeks, and 14 weeks, and at 3.5, one may wonder which other vaccine is due now. So this record is a very important record, and this is something when you present to the doctor, we always would like to know which vaccines have been given, because each contact with a nurse or a doctor or a health professional is an opportunity to provide immunization.
True.
And this is how it should be looked upon. No child should be left out. No opportunity should be missed for providing immunization to the child. So this record is absolutely essential, that things are very clear. And this card also has other features. It has growth of child being monitored in a particular way. And then that helps us to track children and their health. It also has very nice messages as to how feeding should be given to the baby, how if the sickness occurs, what should be done. So I consider this to be a great asset. And I like every family to have it, to preserve this and to use it, and make sure that at every visit, when immunization is given, it is all recorded, and every contact with the health professional, the card is presented to the doctor, presented to the Anganwadi worker and A&M to understand what action you have done. And I appeal also to the health professionals, doctors, nurses, A&M, Nasha, to use this card to educate.
Right.
To show the features of that particular card and say, अब आपको ये खाना खिलाने की ज़रूरत है, आपको ये करना है. So this is a very important asset, and we are happy that we now have a card which is very effective, which is very colorful,
and which is full of this vital information. Right, right. Now, Dr. Rakesh, we have no doubts about this program and about all the, the new steps that are really being taken. But I'm sure it again must be a Herculean task to monitor such a huge program, because it's humongous in size and our country is so huge. How will you all ensure that all these programs are being considered and are being really, effective to the T?
See, when we started thinking about this mission in the Dhanush, I think the planning, as Dr. pointed out, is very important. So we're very sure that unless we plan it properly, we won't really, go ahead. And my minister was very particular. He said, I want to know and why I want to understand even the minutest details of the planning process. So I think we started this planning about 3 months or 4 months back. So in the planning process, like what we did, that we have not really covered all the districts. In the first phase, what we have done, that we have identified 201 districts, like we have about more than 650 districts in the country. 201 districts, and these are the districts where more than 50% of all these left out and missed out children are there. So I think this is the first. So we want to target, I would say, the worst possible districts in the country. And out of these 201 districts, 82 districts are in 4 states: UP, Bihar, Madhya Pradesh, Rajasthan. Like UP is 44 districts, Bihar is 14 districts, Madhya Pradesh is about 15 districts, Rajasthan is 9 districts. Put together is 82 districts. And again, 25% of all these unvaccinated or partially vaccinated children, they are in these 4 states. So I think firstly we identified those areas and pockets and the districts. That was the first thing. Then comes, brought in all the partners, like the state governments. Again, ultimately implementation lies in their hands.
Absolutely.
Yeah, organizations like WHO, UNICEF, Rotary International, who have really worked wonders in polio eradication. So all these partners are there. So I said, firstly we improved on the micro plans. Then second was, the orientation of the frontline workers, like engagement of ASHAs, the Anganwadi workers, and our ANMs who are going to really do the work at the ground. I think that was another important thing. The third important component I said was the IC activities, which is again very, very, very important. The fourth component, which you're talking about monitoring, is very crucial. And why I'm saying so, anything which is monitored would be done.
Absolutely.
In our case, what we have done, that we have put in about 3,600 people who are going to monitor this problem. So we are starting from tomorrow, and there are 2,100 monitors from WHO who are going to monitor the activity, the real immunization activities in the ground. So at an average of maybe 15 to 20 monitors per district, the kind of force we have put in. Similarly, we have requested UNICEF, and they have provided more than 1,300 monitors only to look at the IC activities, so that we know that whether we have planned anything in terms of IC, whether they are being implemented. And we also put in about 201 national level monitors. So national level monitors are going from this side.
So which means that no pocket is really going to be left out, if that's what I can gather.
And then we have a control room established.
Oh, all right.
So starting from 7th of April, so our activities, they start from 7th of April to 13th of April. So this is the first phase. The second is going to be between 7th May to 13th of May. The third round is going to be between 7th of June to 13th and 7th of July to 13th. So this is going to be the first phase. And in second phase, we are going to take up 297 districts. They are called as mid-priority districts. So high priority districts 201 in the first phase, followed by. So I'm pretty sure that we are going to improve not less than 5 percentage point increase per year, the kind of rate.
Well, I think the program sounds really fantastic, and we can only wish that it is a great success in the years to come. Well, so on that note, I'd like to say thank you. I really wish we had more time to take this forward a little more, maybe some other day. But thank you so much for coming here and for giving this kind of vital information to our viewers. Thanks a lot.
Thank you.
So, well, folks, you must write to me and tell me as to what more you would like to see on Healthy India, and also particularly also about immunization. If you have still any questions in your mind or anything that you would want to share with us, do write in to me on this address.
Healthy India, FB 116, Lok Sabha Television, Parliament Library Building, Parliament House, New Delhi 110001. Email healthlstv@gmail.com. And our toll-free number is 1800115314.
Well, so Mission Indradhanush, this is the immunization drive that has been launched by the Ministry of Health, and you and I together can make it a success, because the government can only launch a program, it can give you manpower, it can give you immunization, but success only depends on the public. So that means the participation has to be from each and every citizen of this country. So if you know about it, well and good. Do try and educate the people around you, especially the ones who may be your domestic helps or your chowkidars, your drivers and what have you. The people who may not really know what immunization is all about, these are the people whose children are missed out or they get dropped out of these programs. So, but we know that the government is doing its best, so let's try and make Mission Indradhanush a success. So on that note, it's a wrap up of this discussion. Join me next week when we'll be talking about another health issue. Till then, this is Lottie Alaric saying goodbye, and do get every child immunized.